All right, Lisette, thank you. Now, there are a lot of new developments to be on the lookout for over the next couple of weeks.
Yeah, certainly light at the end of the tunnel. Not there yet, though. Of course, COVID-19 still surging across Connecticut. And right now, joining us to talk more about that and more about the vaccine and distribution, Dr. David Banach from UConn Health. Good morning, doctor. Are you there with us? There you are, yes.
Yes, I am. Thanks for having me on.
Yes, glad to have you here.
All right, first question. Some health experts believe we are just now seeing the COVID-19 cases related to the Thanksgiving holiday. What are you starting to see? Do you believe that's true?
So I do think that over the past couple of weeks, hospitals throughout the state and throughout the country are starting to see increasing cases. You know, I think some of this is going to be attributed to the Thanksgiving holiday and gatherings associated with that, as well as travel. But I think the colder weather, the congregating indoors, you know, all of it coming together to lead to the rise in cases. We sort of anticipated this might happen in the wintertime, and you know, it's what we're seeing right now on the ground.
We're seeing a lot of people writing in with a similar kind of question. I have one in front of me. Paul Bradley from Beacon Falls wrote in to say, if I get both, you know, the vaccine, both shots, why would I need to wear a mask after that? After all, I mean, if I'm not going to get the virus, doesn't it stand to follow that I wouldn't be able to give it to somebody else?
So I think that's a really important question. You know, as we know that individuals are going to be vaccinated, what we're seeing from the clinical trials is that the vaccine is very effective in preventing disease and extremely effective in preventing severe disease and hospitalization level illness. So, and the getting vaccine is important on the individual level. You know, what we're still waiting for in terms of data is how much it prevents spreading the virus. So whether individuals who are vaccinated may still have sort of a very mild amount of virus that would shed that wouldn't necessarily cause them to be sick, but still could spread to others. And that's the data that's going to come forward. But I think, you know, the vaccine is still going to be a critical asset in our toolkit to battle COVID-19 and eventually get this behind us.
I know you don't like to speculate, doctors, generally as a rule, but I mean, is there reason to be optimistic that this vaccine will also drastically cut down on people's ability to transmit the virus as well? I mean, is that reasonable to at least hope for?
I think so. I think, you know, from what we've seen with other types of viruses against other types of vaccines against respiratory viruses, there is that protection that even if one does acquire the virus, the amount that's there is much less. Therefore, there's less viral shedding and less transmission to others, that's potential transmission to others. So I think that potential is there, and I think we do have to get the data on that, but I think there's a lot of optimism based on what we've seen with other types of vaccines that that'll be the case. But in the meantime, you know, we have to double down on our vigilance with the masking and the other protective measures that are in place.
Any idea when that data would come out? Would this be after the vaccines are distributed?
So I think the data is going to continue to come in the weeks and the months ahead. Remember, the trials, the phase 3 clinical trials have been quite large, you know, upwards of 60,000 individuals included in these trials. But you know, when we think about rolling out the vaccine to all of our healthcare workers, to all of our long-term care facility patients, you know, over a period of weeks, we're going to get millions of doses out there, and that data is going to be collected on an ongoing basis. So I think you know, the FDA is really attentive to that and has plenty of systems in place to collect that data, and that data is going to be released as it comes in, and we'll learn more and more in the coming weeks to months.
Well, Dr. David Banach, you have taken a lot of time to give us your insights, and thank you for doing it once again. I'm sure we'll be talking to you again in the next couple of days.
Thanks for having me.
It's good to have you on. And he brings up a good point. Even the FDA is saying a lot of these people who enrolled in these trials, the trials are still going on. While we've gotten a lot of answers, of course, a lot of you out there still have concerns about long-term effects. And well, we just won't know until we get to the long term. But again, it is usually reasonable to assume that the longer we go here, and we've gone for a while, the less and less likelihood there are going to be a lot of long-term serious adverse effects.
A wait-and-see situation.
It's just got to be wait and see, yeah.
And we'll keep you updated. All right, still to come this morning on the Fox 61 Morning News.